Hello everyone. Today we are going to discuss about some important clinical scenario based questions from your general anatomy chapter named is lymphatic system. So let's see how the question comes in your exam. This is the question 1. Now this question is a question based on the direct information. Which of the following feature best explain the higher permeability of the lymph capillaries as compared to blood capillaries? That means before attempting this question, you should have the idea what are the differences between the blood capillary and lymph capillaries. So dear students, the important thing which you have to keep in mind that lymph capillaries always carries the larger molecules and colloidal material. That means the lumen of lymph capillaries are larger. Second thing is that these are highly permeable. Now to achieve the high permeability, the endothelial lining, that means the simple squamous epithelial lining in the lymph capillaries has to be discontinued to make it highly permeable. The another important thing is that the lymph capillaries always start as a blind end, but the blood capillaries never starts as a blind end. So these lymph capillaries blind ends are having the simple squamous epithelial lining, and there is a clear cut discontinuity is there, and overlying basement lamina or basal lamina is also having discontinuity, but these epithelial cells are overlapped with each other in such a way that they act like a flap. That means the colloidal material once enter inside will not come out. That means they are avoiding the leakage of the fluid into the tissue. So when you will see the four options, which is the perfect thing which you should know about the capillaries, which is the lymph capillaries. Continue basement membrane? No, I just told you their basement membrane is discontinued to make it more permeable. Presence of RBC cells in the lumen. Lymphatic system never have the blood vessels or blood cells like RBCs. Blind-ended structure with discontinued basement membrane is the answer. Presence of tight junction. The tight junctions always make the cells very closely adherent and make them very less permeable. So the only answer is C, which is the blind end, and there is a discontinuation of basement membrane. The second question is, now there is a small case is there. A patient develops the brain edema. Patient is having the collection of fluid or brain edema after the head injury. The excess fluid cannot be drained by the lymphatics. Why? Because the brain has a poor venous return, the brain has no lymph capillaries, the brain has too many tight junction, the brain has no interstitial fluid. So dear students, the answer is B, because what is happening here that the brain itself is not having any kind of lymphatic capillaries. Now if you will see the body, you will realize there are so many places where the lymph capillaries are absent, like the epidermis, like the hyaline cartilage, like your nails, like cornea, like brain, where you don't have the lymph. So because the lymph is not there, lymphatic capillaries are not there. So this is not because, so this edema is not actually drained by the lymphatics. Why? Because they are absent. It is as clear as that. Clear? So the lymphatics are not responsible for draining this edema because the lymphatics are absent in this organ of the body. Now we'll move to the next question. A 6-year-old child develops severe viral infection after surgical removal of a gland, and that present in the upper chest. Now, which primary lymphatic organ has been removed leading to this immune deficiency? So there are two clues are there in this question. First, this is present into the upper chest, and second, it is a primary lymphatic organ. Now, when you will see the lymphatic system, you know that there are two sets of the lymphatic organs, primary and secondary. The primary lymphatic organs are bone marrow and thymus. And when you will see the secondary, it is your lymph node and spleen. Now, these primary organs are basically responsible for the production of lymphocytes. Now, here you can see there is a second clue is upper chest. That means this mediastinal area of your this chest is also consisting of this gland. So, what should be the answer? So, primary lymphatic organs, which is the primary lymphatic organ? This is the only organ given here in the option, and this thymus is retroexternally present here in the mediastinum. So spleen is not a primary organ, thymus is not a primary organ, lymph node is not a primary organ, and tonsil is not retroexternal. Tonsil, you know, they are present in the oral cavity and it is not a primary organ. So thymus is the only primary organ which is present into the upper chest. Now we'll move to the next question. Now this question says that a newborn baby is found to have a genetic defect resulting in the absence of thymus. This question is again concerned with the thymus. The child later develops severe viral and fungal infections. That means the thymus is having very important role into the immunity of an individual. Now, which of the following process is mostly affected due to the absence of thymus? So, if thymus is not there, the immunity has been compromised and this child is having recurrent infection. So why the immunity is compromised? Thymus is a production of mature B cell, thymus maturation of T lymphocyte, production of plasma cells, activation of macrophages. Now when you will see these four options, you will realize that the thymus is the site where you will have the production and maturation of the T lymphocytes. Clear? So this is a direct question which you always keep this thing in mind, that whenever you are having the thymus is a site where you have the maturation and production of the T lymphocytes. Now we'll move to the next question, that a 30-year-old woman develops repeated bacterial infection after her spleen was surgically removed during trauma. So now which organs has been removed here? Spleen. Now which of the following statement best explain this condition? The spleen is a secondary lymphatic organ. I just told you that spleen is a secondary organ. So it could be the answer. The spleen produces mature T cell. No, it is a function of thymus. The spleen is the main site of the lymphocyte production. No. Then the spleen has no immune function. Immune function is there. Always the spleen is having the immune function. So what is the immune function? Generally you will have the filtration of the macrophages and other dead cells into the your spleen. So answer is A. Spleen is a secondary lymphatic organ. Which is the another secondary lymphatic organ? I told you, lymph node. Now this is the last question of this session. A 3-month-old infant is brought for evaluation due to recurrent viral and fungal infection. Again, that one important thing is we are talking about a small child who is 3 months old, and a CT scan of mediastinum shows a small thymus for the age. That means the thymus is still there, but it is not as developed as it has to be developed for this much age of infant. Now, because of this underdeveloped thymus, this child is present with the recurrent infection. Which of the following is not true regarding the thymus? So, thymus is a primary lymphoid organ. Yes, it is right. It possesses typical lymphoid nodules. It consists of epitheliocytes forming its framework. Now, what is epitheliocytes? These are epithelial reticular cells. These epithelial reticular cells are important to form the framework of your this thymus. So thymus is having the epitheliocytes or epithelio reticular cells. Now it is the site of T lymphocyte maturation. Yes, I just told you that T lymphocyte production and maturation take place into the thymus. So this is also right. So which is the wrong answer? Answer is here. Now B is not correct for the thymus. Now generally what will happen when you will see the lymphatic organs, we divide these lymphatic organs into the cortex and medulla, and here you will have the nodules. Now these nodules are known as lymphatic nodules. Like you will see in the palatine tonsil, you will see the nodules into the your lymph nodes. But the thymus is not show any kind of the typical lymphoid nodules as seen into the other organs. Clear? So by the end of this session, I hope you are able to understand that what type of questions may be asked in your exam and how to approach the questions. There are two approach. One is by seeing the question directly, or if you are having any confusion, you can go from the options also. But you should have the basics in your mind that how to go and how to attempt these questions. Now, by the end of this lecture, you can take your notes of this class by scanning this QR code, and I hope that this QR code will help you for the rapid revision and to see how these questions will appear in your exam. Clear? So for more such videos, you can also join my membership program, where you will have lots of such videos with the QR code scanning for your revision purpose. So thank you for this session and good night.